In today's video, we are going to be looking at the complications of cryptic pregnancy. In my previous videos on this topic, I said cryptic pregnancy can go unnoticed for up to 20 weeks or even up to the time of delivery. Testing do not detect it, ultrasound do not detect it, and there is no sign and symptoms of pregnancy like nausea or vomiting. Welcome back to my channel. If you're new on this channel, please subscribe and turn on notification. And for my returning subscribers, thank you so much for stopping by. Alright, in this video we are looking at the complications of cryptic pregnancy. Just like every other pregnancy, cryptic pregnancy has its own complications, and it is the same with every other pregnancy. But the difference is, in the case of cryptic pregnancy, these complications can go unnoticed because the woman do not know that she is pregnant. She is not attending antenatal, so it might never be detected, and this can cause damage to organs in the body of the woman. Alright, so the first complication we are going to be looking at today is the pregnancy-induced hypertension. Pregnancy-induced hypertension is hypertension that happens as a result of the pregnancy. This individual might not be hypertensive and may never be hypertensive. So the change in the body due to pregnancy, the hypertension is induced. And most times after delivery, the blood pressure returns to normal and it remains like that. But in the case of cryptic pregnancy, the woman do not know she's pregnant. So even if there is a high blood pressure, it will go undetected. And this can cause damage in her system without her knowing, because she do not even know she's pregnant. She's not attending antenatal. She's not visiting her healthcare provider. So this can go unnoticed for a long time. Number 2 is gestational diabetes. This is high blood pressure that happens due to the pregnancy. Okay, this individual, like I said in the case of the hypertension, might not be diabetic in real life, but because of the pregnancy, this happens. And as soon as the woman gives birth, the sugar level in most cases returns back to normal. Alright, so if you have a normal pregnancy and this is detected during antenatal, you are treated, you are placed on treatment to prevent complications to the baby. Okay, but in the case of cryptic pregnancy, the woman does not even know she is pregnant, so she's not attending antenatal, and this can go unnoticed, causing silent damage to the woman's system. Number 3 is preeclampsia. Preeclampsia is extreme high blood pressure in pregnancy. This can actually lead to rupture of blood vessels if it goes unnoticed. In the case of cryptic pregnancy, it is not detected because the woman is not attending checkups, and this might just go unnoticed and then cause damage in the woman's system. Another one is fetal alcoholic syndrome. Note that when you are pregnant, there are lots of things you cut down on, like intake of tobacco, alcohol, and the rest of them. But because the woman with cryptic pregnancy do not know that she is pregnant, she can go on consuming alcohol, consuming tobacco, even marijuana, things that are unhealthy to her and the baby. And excessive consumption of alcohol in pregnancy can result to fetal alcoholic syndrome. I'm going to talk about that in another video, okay? And also, there could be injury. Alright, so because this woman did not know she's going to be pregnant, she did not know she is pregnant, she might go into labor unnoticed. Imagine just going to the restroom and then you're pushing out baby. There can be cervical tear, severe cervical tear, because the labor is happening without the help of a trained personnel. So a lot can go on. Injury even to the baby can happen because this pregnancy and the labor is going on without adequate care. And also there could be low birth weight in the case of the baby, because this woman did not attend antenatal. She did not take all her prenatal vitamins, no checks, no monitoring. So the baby can come out with low birth weight. Alright, and even sometimes birth injuries. Alright guys, so these are some of the complications of cryptic pregnancy, and these complications are lesser in cases of normal pregnancies, because normal pregnancy kind of go for checks and these things are detected and treated. But in the case of cryptic pregnancy, these complications can go unnoticed and cause irreversible damage to the system of the woman because the pregnancy is not detected. So how do we help women who have had cryptic pregnancy? Even in normal pregnancy, there is postpartum depression. So in a case where the pregnancy is not even detected and then the woman gets to deliver without knowing she was pregnant in the first place, it can result to severe depression after pregnancy. Because number one, this woman was not emotionally prepared. She was not psychologically prepared. She was not physically prepared to welcome a baby, and then the baby just comes. So it can be really draining. So if you notice that this woman is depressed with signs such as irritability, loss of appetite, hatred for the unborn baby, and other symptoms that are abnormal, kindly report to her healthcare provider as soon as possible, and also get her a counselor to help her get through this period, because it can be extremely traumatic for the individual. All right, guys, so this is how to help a woman who has had cryptic pregnancy. So thank you all so much. This is where we're going to be stopping in this particular topic. If you are yet to watch the facts about cryptic pregnancy, I'm going to drop the video in the description box. And also for those who have not heard about the scam that is going on with cryptic pregnancy, I am also going to drop the link to that video in the description box as well. So thank you all so much for watching this video. Please subscribe if you are not yet subscribed to my channel, and I will see you again in my next video. Bye.